The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, oral surgeon Dr. Paul Metz reconstructs his patient's jaw. Podiatrist Dr. Gabriel Maislos treats his patient's chronic foot pain caused by plantar fasciitis. Facial plastic surgeon Dr. Yadro Ducic discusses his philosophy on practicing medicine. ENT Dr. C.T. Wynn helps his patient find relief from constant sinus infections, headaches, and sinus pressure.
Being a cosmetic dentist, it really affected me as I was looking inside the patient's mouths. I wasn't able to breathe, which made me tired and gave me a headache. And it really affected me being able to work on patients.
He wasn't able to breathe out of his nose for the past 20 years. He has this nagging problem of postnasal drip, congestion, and facial pressure. Dr. Casaberry has tried everything, and he is frustrated with the circle of antibiotics and medication. He consulted me because he wants a permanent solution to his problem.
My first impression of Dr. Wynn was, wow, amazing. He brought me back, he showed me the problem. He actually diagnosed me having a deviated septum, which means my nose is kind of crooked upside in there. But I really liked how it was very personal and I didn't feel as though a number. It was really great.
Dr. Casaberry is an appropriate candidate for in-office balloon sinus dilation. Balloon sinus dilation is an FDA-approved procedure that uses a small balloon to open obstructed sinus drainage pathway, similar to the procedure used to unplug arteries that we call angioplasty.
The whole procedure was great. I came there that morning. He did the procedure, and the most thing I felt was just a little pressure inside the nose. Very, very comfortable, and actually I came back to work the next day.
The number one reason that patients come to see me is because they can't breathe through their nose. Most of the time, there's a simple solution for that. It's either a small in-office procedure or a minor surgery that can solve their problem. Medicine has advanced so much that there's always a solution to breathe well and live well.
After the surgery, I was breathing and I heard a lot of noise. So I called Dr. Wynn. I said, Dr. Wynn, something's wrong. I said, every time I breathe, I hear noise. He kind of laughed. He said, you know, Derek, you're breathing. You have space to breathe now. That's just the air going in that you never heard before. So I was like, whoa, okay, great. It just really changed my whole life while working on patients. I don't have the clogged nose, and glad I did it. Very glad I did it.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Engaging in casual conversation with others may help keep you as sharp as doing a word puzzle, according to some studies. Just 10 minutes of daily chatter appears to improve mental function and preserve memory.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
the plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that I honestly, in my practice, I probably see 10 to 15 times a day. So typically, someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle, and it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The 10X procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using like a microtip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
For more information on this doctor, call now or go to bestdocsnetwork.com.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Find your doctor on bestdocsnetwork.com.
The ideal patients for dental implants are ones that have been through lots of restorative procedures and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Wouldn't it be great if we had a blood test that could tell you if you had cancer or you don't have cancer? Well, we don't quite have that yet, at least for most cancers, and in the future we probably will. I would say within 5 years there will be tests that we can do on your blood that will tell us if you have a tendency towards certain cancers or if you even have cancer cells in your body. There's a lot of genetic testing and a lot of research going on, so there's great things are going to happen. Now, as it is now, there are certain tests, for example, for ovarian cancer. There's a test called CA-125. You don't need that test unless you have a strong family history of things like cancer of the uterus or ovary cancer in your family. However, it is a good test and can tell us if that cancer is brewing. There are certain tests that help us with pancreas cancer. But in general, the blood test that you have when you do your physical give the doctor a clue as if you are at risk for cancer. For example, you might be anemic, or your platelets, which is part of your red blood cell count, may be high. There's also other things like liver tests that may be elevated and that indicate your cancer risk is high. So get your blood test done, check it out, and hopefully in the next 5 or 10 years there'll even be better blood tests.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as uniquely individual.
I am getting older, and teaching is my third career. And what I observed was the older looking teachers were losing their jobs, and I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Duchik and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall a positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Every day I get to make people feel good about themselves, and I wanted to feel good about myself again. Look at me now, I'm a brand new person. I make time for what's important. Now nothing passes me by.
My family means more to me than anything. So now I exercise and make healthy choices. My one reason was my family.
My one reason was for me.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Request an appointment on bestdocsnetwork.com. Coming up on the second half of today's show, Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care. Houston Northwest Medical Center features its breast center. Cosmetic dentist Dr. Guy Lewis helps a wounded warrior improve his smile. Interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for severe carotid stenosis.
Miss Richardson, wonderful woman, very busy, and she was just dizzy, and she wanted to be checked out. And we did our routine screenings of our patients where we check the heart with ultrasound, the carotids, ultrasound, aorta, legs, all of those things. Well, what we found was large plaque in the carotid, large plaque, and with a very abnormal velocity or blood flow.
But she sent me to have an MRI, and they found something, and so they sent me to a neurologist who ran tests and finally sent me to have a CAT scan and found out that my carotid artery was blocked. So she sent me to St. Luke's to a Dr. Krager who put a stent in.
People will have dizziness. Sometimes there are no symptoms. So silence is not golden here. Silence is deadly. So that's why it's so important to be checked. In the literature, of course, we know that the older we are, the more oxidative stress, the more plaque formation occurs in the vessels. But I have found young people to have already atherosclerosis or plaque formation. So if we can find it at a younger age, in their 20s and 30s, that they're developing plaque, we can protect them from presenting like Ms. Richardson did, you know, with a severe blockage that could only be fixed by surgery.
She's very personable. She has plenty of time to talk to you and tell you what the symptoms are and what can be done, and she's very caring.
Carotid disease can also present with symptoms of numbness or tingling, difficulty speaking, changes in the facial shape. Basically, people may not be able to smile, or maybe they've had small strokes where they can't move their face or speak or move their arms or legs like they used to. So those things should be checked even if they're subtle. You should check with their doctor.
When you find a doctor that you can recommend to your friends and to your family, it's great. I'm not a big fan of doctors, but I just love her to death.
For more information on this doctor, call now or go to bestdocsnetwork.com.
If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with a very complex spine problems. However, not everyone may need spine surgery. So we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeon. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the spine care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
For more information on this doctor, call now or go to bestdocsnetwork.com. Ask our doctors on bestdocsnetwork.com.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The Breast Center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If a patient comes in with a palpable lump, we want to find out what it is. Doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes a torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The Breast Center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone, because we're going to walk it with you.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Watch more videos on bestdocsnetwork.com.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving there was an SV bid on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was at Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
For more information on this doctor, call now or go to bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.